How are brain tumor biopsies examined? Have you ever wondered how doctors figure out what type of brain tumor someone has? It all starts with a biopsy, which is a procedure to take a small sample of brain tissue. This sample is then examined by pathologists, who are specialized medical professionals trained to diagnose tumors and guide treatment. The most common method for obtaining this sample is called a stereotactic brain biopsy. This is a minimally invasive technique that uses advanced imaging, like magnetic resonance imaging or computed tomography scans, along with computer-guided navigation. This helps doctors precisely target the tumor area in the brain. During the procedure, the patient's head is secured to prevent movement. A small incision is made in the scalp, and then a tiny hole, known as a burr hole, is drilled into the skull. A thin biopsy needle is carefully guided to the tumor site using real-time imaging and three-dimensional computer technology. This needle extracts small tissue samples from the tumor. Once the tissue sample is collected, it is sent to a pathology laboratory for examination. Initially, a rapid analysis called a frozen section may be performed during surgery. This involves freezing and slicing the tissue sample, allowing a pathologist to quickly evaluate it under a microscope. This quick assessment helps surgeons make immediate decisions during the procedure. After the frozen section, the tissue goes through more detailed processing. This includes fixation, embedding, and staining with special dyes. Pathologists examine the cellular structure, looking for characteristics such as cell type, tumor grade, and any cancerous features. Additional tests, like immunohistochemistry or molecular studies, may also be performed to identify specific tumor markers or genetic mutations. These detailed studies typically take several days to complete and provide a definitive diagnosis that informs prognosis and treatment options. In some cases, if a larger tissue sample is needed, or if there is a higher risk of bleeding, an open biopsy or mini craniotomy may be performed. This involves removing a small section of the skull to access the tumor and obtain a larger sample for analysis. Other biopsy techniques include fine needle aspiration, which uses a very thin needle to extract cells, and core needle biopsy, which uses a wider needle to obtain tissue cores. The choice of technique depends on the tumor's location and clinical considerations. Overall, the examination of brain tumor biopsies is a careful process that combines precise surgical sampling with detailed pathological analysis. This is essential for accurately diagnosing the tumor type, which is crucial for planning effective treatment and maintaining brain health. All biopsy procedures and examinations are conducted under strict medical protocols to minimize risks and ensure accurate results. Always consult healthcare professionals for personalized medical advice.